name is Isabel Anderson. I'm originally from Alexandria, Virginia, but my parents live outside Boston now, and I went to undergrad at Tulane University. I studied public health, and I continued on and got my master's of public health also from Tulane. So I've been here in New Orleans for quite a while now. And actually, when I was a senior in my undergrad and during my graduate year, I worked as an emergency department technician here at Ochsner. So that's kind of how I learned about the program and what kind of encouraged me to apply and eventually commit. So I first heard about the UQ-Ochsner program because I worked at Ochsner. So I met a lot of the UQ-Ochsner students as they were rotating through the emergency department. And I felt like it was the right fit for me. One, because I'm passionate about global health and got my master's of public health and international health and development. Also, I really enjoyed the teaching at Ochsner. Even as a pre-med student, they were always including me. The attendings were always trying to show me cool scans or just kind of impart clinical knowledge. And I also felt like when I spoke to the students who were rotating through the emergency department, they just seemed really happy and had a lot of great things to say about Australia. And I also wanted to be able to experience a different healthcare system. I'm passionate about advocacy and to see my future practice being involved maybe in the legislative sphere, policy or advocacy side. And I think a huge issue right now in American politics is healthcare reform. So I really wanted to be able to experience a different healthcare system and be able to experience both the pros and cons of that system and be able to kind of use that to inform my future practice. Yeah, so when I got on the plane to come to Australia for the first time, it was at the end of 2021, so it was just after lockdown had ended for COVID, and we were all going to Sydney because of the border restrictions to spend 2 weeks there before entering Queensland, and I was very excited. I'd always wanted to go to Australia. I knew it was summertime. I was excited for the beach, but I was also a bit nervous. Moving like halfway across the world without knowing anyone was kind of daunting, but overall I was really excited for this new adventure, and yeah, couldn't wait to get there. Life in Brisbane for the first 2 years was the best. I loved it so much. It was a great city to live in. When I think of Brisbane, I just think of sunshine and great coffee and friendly people. It was a lot of hard work. The first 2 years of medical school is like drinking from a fire hose. There's a lot of clinical knowledge that you have to learn in what feels like a short period of time. But I also had a lot of fun. You get really close with your Ochsner classmates because you're all in this crazy med school experience together where you've traveled thousands and thousands of miles away from home and you don't know anybody. You also get really close with all your Australian friends and other international friends. And yeah, it was just a really amazing experience. I was able to travel and see parts of the world that I'd only dreamt of being able to travel to, and overall I had a really amazing experience. Transitioning to New Orleans from Brisbane was not difficult for me because I lived in New Orleans for such a long time, but I think it is such a difference of being in one part of the world and then very quickly having to transition to a new part. But it was also really exciting because you've been working hard for the past 2 years, studying a lot, and then you're finally at the part of your training where you're going to spend most of your time actually interacting with patients and feeling like you're really like a doctor in training. And so that part was very, very exciting for me to be able to go into the hospital with my white coat and actually interact with patients and like build on the knowledge that I've already gained through actual like practical skills. So it was very exciting, but it was also a little sad to say goodbye to everybody in Brisbane, but I was also very excited just to continue on this really long journey. And also I knew that I was going to go back to Brisbane for our rotation in 4th year, and so I was excited to see my friends then. I think what stands out most from my clinical training at Ochsner is one of the leading medical providers in the United States, #1 healthcare provider in the Gulf South region, and just really, really strong teaching hospital from day one. You're included in as a member of the team and expected to round on patients, come up with diagnoses and plans and present them. So I think that's a very strong aspect of Ochsner. Also very large health system with pretty much every department that you can think of, every specialty you can think of. So many opportunities to shadow and work in different departments that you may be interested in. Also lots of research support if you're interested in research, and then also a huge commitment to improving the health outcomes of this population. So Louisiana is ranked 49th or 50th in most health outcomes, and Ochsner, in partnership with a bunch of other health organizations, has developed this plan called Healthy State, where the goal is to be 40th or better in all health rankings by 2030. And so it's been really amazing to see this organization put a lot of time, money, and effort into improving the actual causes of ill health and addressing those social drivers and determinants of health. So that's been really great to see. So I think studying in two different healthcare systems gives you a very unique perspective. So I think as we're becoming more globalized, it's important that doctors have an understanding of different cultures and different healthcare systems. As I mentioned before, I think healthcare reform is a huge issue in the US, and I think as doctors we're going to need to have an opinion on it and actually know potential solutions for our healthcare system here in America, potential improvements. And so I think having that knowledge and background of a different healthcare system, one that has a lot of aspects that I think that would be beneficial to the US healthcare system, I think that's a huge aspect. I also think learning and working with diverse populations. We are United States, a country of immigrants, and there's also a lot of immigrants in Australia as well, and being able to work with diverse populations I think is something that's essential to being a great physician. I also think there's a lot that we can learn from Australia about how they interact with Indigenous populations and the healthcare provisions that they've done for Indigenous Australians through the Indigenous Health Service. And yeah, I just think that's all those aspects are great for your training. Okay, so over the past 4 years, I would say I'm most proud of the growth that I've seen in myself. I think being in medicine, it's very easy to be hard on yourself and a perfectionist. I think that our profession attracts a lot of people who have that mindset, but I think when you stop for a moment and you look back at who you were first year and how little you knew, and maybe how at least I was a little bit timid and afraid and didn't really know how to fully interact with patients and felt like I knew nothing, and now as a fourth year I still feel like I know nothing because you're always learning. We're in a profession of learning, but I look back to where I was first year and I'm like, wow, look at that growth. Even beginning of third year, beginning of my clinical rotations where I didn't even know how to write a note, what was the note template, and what questions should I be asking patients to be the most efficient, and how to conduct a focused history and physical exam. So I think that's what I'm so proud of, is the growth that I've seen in myself. So I feel pretty ready to take the next step into residency. I think it's an exciting time, a little bit nerve-wracking, but I definitely think that my training here at Ochsner and my clinical knowledge from UQ, that I'll be right kind of where I need to be ready to be an intern. Yeah. If I were to give my first year self some advice, it would be, I guess, be a little bit more confident in yourself and your abilities. You can do this. It seems hard and daunting, but the path is long, and a lot of medicine is about being knocked down and then picking yourself back up. So I would say don't be too hard on yourself, but also make sure to make the most of your time in Australia. I definitely think that I did, but there's always more that you can see and do, so try to have a good work-life balance, even better than the one that you had. And same for New Orleans, I would say. Try to enjoy your time in New Orleans to the fullest and make the most of your clinical rotations while also immersing yourself in the culture. Yeah, so I think what kept me motivated through the challenges of med school was knowing that I've always wanted this. and knowing that it's a really tough journey, but also that it's a privilege to be able to practice medicine and to be at two great institutions. I remember one time I had been up since maybe like 5 in the morning, 4:30 in the morning, and I was on my transplant rotation, and we went to go do an organ donor call up in Baton Rouge, and it was like 10 or 11 p.m. and I was in the car and I was so tired driving back, and I was like, oh, I'm so tired, I'm so hungry. But then I thought to myself, wow, like what a privilege. Like not many people can say that they've had their hands in an organ donor's abdomen, like harvesting a kidney that could go and save somebody's life. And there was no obligation for the surgical team to include me in this, and they did, and that is just amazing. And so I think trying to think about it positively and how lucky I am to have this experience, that has really helped me through the hard moments. To be a doctor that doesn't just address the physical needs of a patient, but also the social needs, social determinants of health, and really provides holistic care to my patients. I also hope that I can be somebody that my patients trust and feel like they have a good relationship with. I hope to match into OBGYN residency, and I really hope that I can, in that space, both at a community level but also at a legislative level, advocate for policy changes and initiatives that improve maternal health outcomes and women's health outcomes. I feel very excited now that I'm at the end of med school. It honestly was a whirlwind experience. I can't believe 4 years ago I started. But I'm very happy. I'm super happy with the friends that I've made, the experiences that I've had, the growth that I've seen in myself, and really excited for the future. And I wouldn't have changed this experience for the world. I had the most amazing medical school experience, so yeah.